My name is Neil Barber. I'm a consultant urological surgeon at Frimley Park Hospital, and I've been involved with trials in aquablation of the prostate using the Aquablation system for a few years now. Paolo came to see me having unfortunately gone into urinary retention, and that's a very painful episode where you can't pass urine and you end up having to have a catheter sited. He successfully got rid of the catheter but couldn't pass urine himself normally, so ended up having to pass the catheter himself.
My symptoms started probably about 2 years ago, when it became very noticeable that I started to get up on a, if you like, maybe 2, possibly 3 times a night. At the beginning, it wasn't happening every day, but it was happening on maybe, I don't know, 2, maybe 3 nights a week. And it started to become a little bit noticeable.
In terms of options available for him as a young man, looking to see an improvement in his waterworks so that he can pass urine not only better than he did before, but also without the need to pass a catheter, the only options really for him are surgical. This is a procedure which has many novel facets to it, but primarily from his point of view, when I was talking to him, it seemed to be the first surgical procedure that removes tissue to make a large hole, but with a much lower risk of developing dry ejaculation. The other facets then that were interesting from my point of view, as much as Paolo's probably, are the different way in which this treatment is delivered compared to standard surgical approaches. It's an ultrasound-guided, robotically delivered procedure, and that means you're using ultrasound in real time to define exactly what tissue you want to remove, to try and remove the right amount of tissue from the right place and in a safe way.
This was on the Monday. On the Tuesday I was on my feet, walking about, gingerly sort of walking about, obviously taking things a little bit easy. And on the Wednesday I was back at work. My work is, I have a restaurant, so I'm on my feet most of the day, all of the day, so I was moving about. And I think within possibly 3 or 4 weeks, I think when I went to see him again after the procedure, he said, yeah, fine, if you want, you can go back and do light exercises in the gym, whatever you feel, however best you feel. And I did that. And I think probably a few weeks down the road, I was out on my road bike, out cycling with my friends, you know. So
this becomes then the first procedure available where you can remove tissue to relieve obstruction, but without applying heat to the prostate bed, in terms of ensuring a safe post-operative recovery. It still needs a catheter in, and it still needs a day or 2 in hospital. He managed to have the catheter removed the next day and was discharged very quickly.
I haven't suffered since. I don't have the issue where I'm having to go get up during the night. I don't even go often during the daytime, if you like. It's not a case, oh, I've got to go now, or you know, you can hold or whatever. Back to really as I was maybe 3-4 years ago. So yeah, it's I'm really pleased. No side effects. No more getting up at night. No more having that urgency where you've got to, you know, immediately go. Otherwise, you feel like you're going to wet yourself. Absolutely, you know, really good. Yeah, I was very happy with the procedure. Yes, very happy indeed. I can recommend it.